Hi, welcome to Pathology Riddles. Today we are going to deal with this topic called as neutrophilia. So what is neutrophilia? Neutrophilia is increase in the total circulating absolute neutrophil concentration, or it is also called as absolute neutrophil count. When do we call it a case of neutrophilia? We call it a case of neutrophilia when the absolute neutrophil count exceeds 7,500 cells per cubic millimeter. In some books it is given as 7,000 cells per cubic millimeter, but it depends from place to place. In our setup, we take the cutoff as 7,500 cells per cubic millimeter. So how do we calculate absolute neutrophil count? If we take a case where there is total WBC count of 13,000 cells per cubic millimeter, and when we do the differential, we find that there are 85 neutrophils in 100 WBCs. So then we calculate saying if there are 85 neutrophils in 100 WBCs, in 13,000 WBCs, how many neutrophils will be present? So we cross multiply 85 to 13,000 divided by 100. 100 cancels, and then 85 into 130 is how much? It's approximately 11,050 cells per cubic millimeter. 11,050 cells per cubic millimeter is greater than 7,500 cells per cubic millimeter. And that's a case of absolute neutrophilia. We call it absolute when the leukocytosis is also there, that is, the total WBC count is more than 11,000 cells per cubic millimeter, and if there is neutrophilia as well, that is greater than 7,500 cells per cubic millimeter. When do we call it reactive neutrophilia? We call it as reactive neutrophilia when the cause of neutrophilia is not malignancy. It can occur as a response to physiological or other pathological processes, and that is called as reactive neutrophilia. How do you classify neutrophilia based on causes? We classify them as immediate causes, acute causes, and chronic causes. Enumerate some of the immediate causes of neutrophilia. Some of the immediate causes of neutrophilia include if the person is doing strenuous exercise, or the person is exposed to extreme temperature or stress, if the person has an emotional stimuli, or if the patient has just been given anesthesia, or if the patient is in the process of the birth of the child, or in labor. So these are some of the causes where there can be immediate neutrophilia. What are the causes of acute neutrophilia? Some of the causes of acute neutrophilia include inflammation in cases like burns, trauma, surgery, or if they have got diseases like collagen vascular diseases, or there is hypersensitivity reactions. Then it can happen in infections. Infections mostly are bacterial and fungal and sometimes viral. It can also occur when there is hemorrhage, like in road traffic accidents, and also when there is hemolysis, that is breakdown of RBCs. Other causes include injection of vaccines, or if the patient has got venom poisoning, or because of certain hormones, certain drugs. These also can cause acute neutrophilia. So what are the chronic causes of it in neutrophilia? A chronic cause of neutrophilia is a very broad spectrum. It can mainly occur because the infection and inflammation, if they keep persisting, then these become the chronic causes of neutrophilia. Then it can also occur because of drugs, because of toxins, because of hormones, because of hereditary or congenital diseases, because of metabolic disorders, because of hematological cancers. So these all are the causes of chronic neutrophilia. So what is acute neutrophilia mechanism? In acute neutrophilia, these neutrophils actually come from the bone marrow storage pool. So they come from the storage pool, and within hours we can see that there are approximately 10-fold rise in neutrophil count. Usually the later immature forms will come like band forms or metamyelocytes along with the neutrophils will be seen in the peripheral circulation. So this is the mechanism of acute neutrophilia. So what is the difference between this acute neutrophilia, immediate neutrophilia and chronic neutrophilia? We start with immediate neutrophilia. Normally when the neutrophils are flowing in the blood, around 50% are in the axis. They are flowing along with RBCs, while the remaining are marginated towards the endothelial cells. Whenever we do strenuous exercise or if there is stress, the 50% which are there along the endothelial cells will go into the circulation, means in the axis. So that is called as marginated neutrophilia, or also called as pseudo-neutrophilia, because there is not really very much increase in neutrophils. It's just that the neutrophils which are there in the blood vessels along the endothelial cells will go into the circulation, and we will see that it has increased only 2 times, because 50% are in the axis and 50% are along the endothelial cells. Endothelial cells neutrophils will come in the axis, so the neutrophil count will double. So that is how immediate neutrophilia happens. What is Leukemoid reaction? Leukemoid reaction is a benign proliferation of leukocytes, where the number of WBCs are increased, but they are not increased to more than 50,000. 50,000 is cut off. It should be less than 50,000 cells per cubic millimeter, and there is increase in the number of precursors in the circulation. So this is called as Leukemoid reaction. What is the mechanism of chronic neutrophilia? So there is increased activity in the bone marrow in chronic neutrophilia, that is increased production of neutrophils, more of mitosis is happening, and then that goes to the storage pool to the peripheral circulation. So what happens is when it is in hyperactivity, it will also send all the precursors. So other than band forms and metamyelocytes, you will see the earlier precursors also in the peripheral circulation. That happens in chronic neutrophilia, and this is also called as shift to left, means all the precursors are coming into the peripheral circulation, which we normally don't see. Which precursors increase in neutrophil leukemoid reaction? The precursors that increase in neutrophil leukemoid reaction are band forms, metamyelocytes, myelocytes, promyelocytes, and very rarely blast. But remember that the total leukocyte count will always be less than 50,000 cells per cubic millimeter. What is Leukoerythroblastic reaction? It is characterized by the presence of nucleated RBCs. That is, RBC precursors come inside the peripheral circulation, and also there is a shift to left of neutrophilic precursors. Now, what we need to remember is the neutrophilic count, or the total neutrophilic count may be normal, it may be increased, or it may be decreased. It doesn't depend on that. Only 2 things we have to see: nucleated RBCs and neutrophilic shift to left. What are some of the examples of Leukoerythroblastosis? One is myelofibrosis, second is myelophthisis. What does this mean? Mainly the hematopoietic elements are either replaced by fibrosis, or they are replaced by leukemia, or they are replaced by metastatic cancer cells. And another cause is severe hemolytic anemia. What is physiologic leukocytosis or neutrophilia? Physiologic leukocytosis or neutrophilia are present in the first few days of life. This is accompanied by mild shift to left. So these are some of the common questions asked regarding neutrophilia, and you need to have a knowledge of all this even while examining the peripheral blood smear. So I hope you liked this video. If you did, please press the like button and share it with your friends and relatives so that they know what is the causes of neutrophilia. This is Dr. Susan signing out until we meet in the next video.